formed a nonprofit organization called After Cancer. It's providing educational programs, interactive workshops, and patient resources to healthcare professionals in the oncology community. So those patient care team members to address sexual health in a cancer care setting. My mission is that this be a standard of care for all patients impacted by cancer. If we were normalizing these conversations about sexual health for ourselves and for our patients, we would leave a space for patients to bring up questions or concerns or to bring back a concern later on. We're not normalizing this for patients, and so it shuts them down. If you knew that in 30 seconds, you could give a message that would impact your patient's life and possibly their intimate relationship, wouldn't you do it? I mean, wouldn't we all do it? If it was 30 seconds, we'd do it every day. Here's the 30-second message, and there are 6 components of it. But this can be done in 30 seconds. So issues are common and expected, and we believe they're quality of life issues. And the clinical setting is where you should come. You should bring those back to me. And we have resources to help. And we get it. You don't care about it now in the wake of this diagnosis. We know you're not thinking about that. That's all right. What we know, though, is studies show caring about it sooner versus later will make a difference in the outcome. That's your 30-second message. There are more and more people surviving their cancers today. 16 million survivors in the country alone. Of those 16 million, 9.3 of them are dealing with long-lasting sexual health side effects from the cancer or its treatment. Depending on when you are talking to your patient, this may be the furthest thing from their mind. So it's easy to not talk about it, right? It is easy not to talk about it if the patient isn't ready to talk about it. But what you're doing by just initiating this conversation with 2 or 3 sentences, and truly it's under 30 seconds, is you're really providing the space for them to bring it up at a later time. They know you've normalized it. It's important to you. This is the correct venue at whatever point they need to. So you're really doing just a wonderful thing for your patients by just getting an introductory message down. Try to put yourself in a place where you have conversations with your patients. As we go through with it, think about what's important for you. It's going to be different for everybody. When do you talk to your patients? When does it ever come up to talk about side effects? Because that's the place it belongs. Earlier versus later, and then every appointment thereafter if there is a space to do that, if it's about side effects. When you have the confidence to say something, people go right with you. If you've got the confidence, if you're sure of yourself about why you're saying it, if somebody said, I'm not interested in hearing about that, you could say what would be the appropriate thing to say, that's perfectly fine. The reason we bring it up is, and then you could fill in the blank. Because if you don't attack these issues sooner versus later, you may not have as good of an outcome. That might be important for them to know. I mean, it's the most important thing for all of us to know. Of course you don't feel like talking about this right now. You're dealing with cancer. It's the same reason that the oncology docs don't necessarily feel like it's important to talk about it all. They're curing cancer. It's not important this minute, but if you don't know some of the impact that your cancer treatment's going to have on you, you're not going to know to come back to even talk about it later. Patients say that they want their healthcare providers to address this topic with them, that they want you to initiate the conversation. They want the topic normalized. They want to be able to bring their concerns forward and not feel awkward doing it. They want to have expectations set for what's going to happen after treatment. Because often patients are surprised that after their treatment, their sexual functioning is compromised. And if an intimate relationship is interrupted by cancer, If the issues aren't addressed and resolved, if the thoughts and feelings aren't understood, and if fears aren't expressed, and if expectations aren't set between the couple, that intimate relationship can be forever changed. We call it the communication gap, and it's real. There are reasons that providers don't talk about this with their patients, and there are reasons patients don't either. And what we learned through my work with patients, but then focus groups with providers, really what that communication gap's all about. And from the patient side of things, this is the most vulnerable I am ever gonna feel in my life. Something I thought I had control of my body, cancer appeared. I had no warning of it. I had no control of it. It was the last thing on my mind to think that I was going to control everything else. You know, it's just, I think probably the most vulnerable place patients are is with a cancer diagnosis. So we look to our providers. Patients really do look for guidance. There is this God complex that we give oncologists. We need them to tell us what to do and what not to do, and we follow that to the letter, the perfect patient, you've heard of that? That's all so true. If you're my physician, I will do what you tell me to do, nothing but what you tell me to do.